Welcome to this week's edition of Freedom and Prosperity Radio, the weekly radio news show that we put together here at the Virginia Institute for Public Policy and have been since 2008 so that you have facts, not just rhetoric, to take into any conversation that starts to sound a little like a debate. I know you have them too. Our first guest this week, Senior Policy Fellow at Americans for Prosperity and a Pentagon Health Institute Public Advisor, Dean Clancy, is on with us. Dean, welcome back to the show. How are you doing this weekend?
I'm doing great, thanks.
Thank you for taking some time out. We want to talk about health savings accounts and, you know, where we need to tweak the legislation. And there's part of me, the real libertarian, says, why do we need legislation to give us permission to do these things? You know, since 401ks and things like that are out there. So you've written about it at AmericansForProsperity.org and at the Paragon Institute. Where do we need to be tweaking the health savings accounts so that people can really make hay with them? And as I've argued, if we were allowed to treat them like 401ks, you'd have elderly Americans with enough health savings money set aside. They could be helping their grandkids get medical treatment.
That's exactly right. It's a great question. Why do you need a special savings account for health care? That's what an HSA is, a health savings account. And the reason you need it is because we have an income tax code in this country that basically discriminates against you if you try to spend your money for health care out of pocket or outside the workplace. Mm-hmm. Basically, our system is designed to try to get you to get your health insurance coverage through your place of work. There are some government programs, too, like Medicare, Medicaid, Obamacare. But if you just want to pay money out of your own pocket for health care, that money is taxed, whereas if you do those other things, essentially it's untaxed. Yeah. And so your healthcare dollar doesn't go as far, and as a result, people tend to over-rely on those other sources, and they lose track of the cost of things, and so healthcare costs are constantly rising. We have a medical inflation that's persistent, and that makes it very hard for people. And so the HSA was created to try to, level that playing field a little bit. Mm-hmm. And how it works, you mentioned a 401k. It's a lot like that, or an IRA. It's a special kind of account that you can put untaxed dollars into, like from your employer. You can also, invest the money if you want, or just use it like a bank account. Whatever it builds up in the account is not taxed, the interest or capital gains. And then when you spend the money, as long as you spend it on qualified medical expenses, that too is untaxed. And that's how it's different from a 401k or IRA, because with those, you either pay tax going in or you pay tax when you take the money out. But with the HSA, you never pay tax on that money. And so as a result, your money can go up to 40% farther. It's like having a discount on every purchase. When you buy a medical device or a doctor's office visit, get an MRI, or what have you. The second benefit of the HSA is that it gives you more choice and control. You can use it for things that your health insurance plan maybe doesn't cover. You can use it for doctors and facilities that may not be in your health insurance plan's network. So it just shifts a lot of power back to you, the patient. Mm-hmm. And that's the problem in American healthcare, is that the patient isn't really the customer. The patient is kind of the product. And as a result, costs are too high, quality is too low. You can't see the price of anything. It's not like the grocery store where you walk into the doctor's office or the healthcare system and you see all the prices. It's just not like that in American healthcare. The HSA will help to change that by putting patients in charge of their own dollars. And the last point is 30 million Americans have an HSA today. It's almost 1 in 10 Americans. But 9 in 10 of us really have no access to an HSA because of federal rules and red tape that we at Americans for Prosperity are trying to remove. If we can remove those barriers, every American could have access to this powerful healthcare tool.
Well, talk about those. Dean Clancy is on with us from Americans for Prosperity, because I know one of the first head slappers in this was at the early onset, HSAs were only allowed to be carried for a few years, so you couldn't build up over time. You couldn't start at 25, and then as your elderly years started to befall you, when you were going to have the most medical, needs, you would have a lot of money saved up. So the disbursements had to be more frequent, or you couldn't roll it over year. I know some people have tried to tweak that, but what other red tape is in there that are keeping so many of us out of it?
Well, there's two things. First, you're right. An HSA is an account where if you don't spend the money, you get to keep it. You roll it over in perpetuity. So you could, over time, build up quite a substantial health care nest egg. And, Fidelity, the experts at Fidelity, every year they put out a number of the amount of money you can expect to pay out of pocket when you turn 65. Even if you have Medicare, you're still going to have a bunch of out-of-pocket costs for health care. For the average couple turning 65, it's $315,000 over the rest of their lifetime. With an HSA, you could have that amount saved up if you start your HSA when you're young. And whereas compare that to a workplace health reimbursement account, HRA, or a flex spending account, FSA. I know there's a lot of acronyms and accounts, but those workplace accounts, you lose the money at the end of the year. It's use it or lose it, and you have people going out and buying eyeglasses and things at the end of the year just so they don't lose that money. But with the HSA, you don't have to do that. It just builds up over time. And by the way, when you die, you can leave it to your loved ones. And also, you can spend the money in your HSA on your dependents, so a spouse or children. Great. And so that's all to the good. But there's a major barrier preventing people from having an HSA, and that is a rule in federal law that says that in order to be able to contribute, you must have a special kind of health insurance with a high deductible and certain other requirements that, frankly, most health insurance today doesn't check all of the boxes. It's not economical. The insurance companies can offer it, but it's often not a very good, not a well-designed insurance product. Also, if you're on a program like Medicare, Medicaid, those are just simply never HSA qualified. You just never can have an HSA, for example, if you're on Medicare. So we want to remove all those barriers. Our feeling is anyone should be able to do this, even people who are uninsured, because they have health expenses too. But if you wanted to make sure people have insurance, just make the definition more reasonable. Any kind of reasonable health insurance coverage should be HSA qualified. If we could just change that in the law, then virtually all Americans would be able to have a tax-free health savings account. Well,
I have long said that, in my view, the best way, if you were going to create the ultimate in individual-driven health care, is a health savings account coupled with a direct primary care association like these, Dr. Umber and Atlas and those, and coupled with a very modestly priced major medical. So if you have a car crash or you come down with cancer and you haven't saved up enough money in your HSA, you have a little backstop, and those were so affordable and still are very affordable for a very small monthly fee, because they're only really covering, it's like the car insurance. It only covers you if you have an accident. It's not there to fix your tires for you. So, that would be, in my mind, the ultimate customer-driven, put the doctors and the patients back in the room together kind of system. Is that unfair?
No. In fact, you are spelling out exactly the ideal future for Americans, where if we all have that, I call it a three-layer cake of a health savings account, a direct primary care monthly subscription where you just pay your doctors directly and have great access and no insurance company involvement. And then you have, as a backstop, like you said, a basic insurance policy that covers the big stuff. If you get cancer or you get hit by a bus, that's why you have health insurance, not to pay for all the little bills. That's why you should have tax-free health savings. If you had those three things in combination, especially if you got your insurance through the individual market where you just purchase it online and you don't get it through the workplace, then now you've got the perfect situation. It's portable, it's yours, you're never going to lose it, and it's going to cover you for what you need, and you're going to be in control of those dollars, and you can, as we said earlier, build up a nest egg to pay for health expenses in the future. That's the vision that we at Americans for Prosperity are trying to create. We call it a personal option in healthcare as opposed to, a government option or Medicare for all where you put the bureaucrats in charge of your healthcare. We think that's totally the wrong way to go. Let's have a vision of individuals able to care for themselves through these common sense reforms.
Dean Clancy is on with us, Senior Policy Fellow at Americans for Prosperity, and I misspoke before, and I could make excuses for why I did, at Paragon Health Institute, public advisor there, although I'm sure the Pentagon could use your help, Dean.
They need health care too.
What about, certainly I think every American could stand for that, but what about the powerful lobbies? Obviously, the insurance companies aren't going to like this because they like this ultra monopoly. I always say that if Standard Oil controlled both the consumer and the distributor of the oil, that really would have been a monopoly because that's what these health management organizations are. We own the consumer and we own the provider. Isn't this great? And so they're going to lobby against it. But what about the doctors? What about these hospital systems like Centara and Inova and UVA Health Systems? Will they go quietly into the good night? Do the rank and file doctors and nurses understand this stuff and get behind it maybe?
Well, I think, first of all, you're absolutely right. We've had a situation where the health insurance companies have become extremely powerful and profitable, and they effectively dominate the system. But also you have these hospital corporations, like you were mentioning, that have bought up all the physician practices, and basically the struggle between the insurers and the hospitals, the poor doctors and nurses have gotten squeezed in between, and they have been, in effect, turned into employees of the hospital corporations.
Right. And you don't even know sometimes. They buy up like an orthopedics office because the orthopedist is getting buried under paperwork, and the hospital system says, well, we have accountants that can deal with that. Just come in, and all of a sudden the orthopedist has to quadruple the amount of patients they see in a day. With the obviously less time spent with each patient each day, and everyone loses.
That's right. And the beauty of the direct primary care model that you mentioned earlier is you cut out all that insurance company paperwork. Now your doctor can actually practice medicine. He can spend a long time with you, and you can get the care you need, 24/7. Doctors love it. Patients love it. It's affordable. You can get a direct primary care subscription for maybe $80, $90, $100 a month for yourself and maybe $10 extra for each child. It's a model that works because they cut out all that insurance company paperwork, and it's better health care. Yeah. And so at AFP, we're working to make sure everyone has access to that. But you're right, these interests are hospitals, insurance companies, they are going to resist this future that we're trying to paint because that means less power and profit for them. But, this has always been the case with monopolies. You just have to fight them. And what we're trying to do, we think of it as the Berlin Wall. We're trying to poke holes in the Berlin Wall so individuals and families can escape to freedom. Eventually, the whole wall will collapse.
So medically, you're saying we're East Germany, is what you're saying.
Exactly. I should work for the Pentagon.
Dean, so when you look at the future, and notice in that group of big businesses, I left big pharma out of it because I think I think when you put it back in the doctor-patient world, big pharma may be your biggest opponent because they are going to see doctors actually trying to fix people rather than just prescribing pain medications for them. Individual doctors who know individual patients are going to be more concerned about people getting addicted to opioids and things like that. So I think, since I think bipartisanly, most people say we have a problem with overprescribing opioids, especially in this country. This idea also, whether it's intent or not to do it, does that as well.
Yeah, that's right. The pharmaceutical interests also have their own kind of monopolies where they're able to, in effect, shut out competition for many years at a time. They set a high initial launch price for their new drug. Now, to be fair to them, it takes 10 years and $3 billion with a B to develop a new drug in this country, partly because of all the government regulation. And we want to break through those barriers as well. We want more competition with, generic drugs and generic alternatives to things like insulin. You can do all that with some very sensible reforms that we are also advocating for as part of our personal option approach. But the pharma is probably not going to oppose you, the patient, paying if they think they're still going to get paid a fair price. The real problem in pharmaceuticals is the middlemen, the pharmacy benefit managers, who are basically an arm of the insurance industry. They have incentives and basically special protection under federal law so that they can actually jack up the price of a drug and make money from that. They claim they're helping, lower costs, but they seem to be doing the opposite. So there needs to be reform of those middlemen in the supply chain. All of this it's the same thing. It's, when you have a market, you're going to have, and the consumers in charge are going to have transparent prices, and things are going to be efficient. The prices are going to come down over time, like you see in computers and other industries where markets are allowed to work, and quality is going to go up. Healthcare is going to get better. And we know this works. One of the problems in Washington is there's a philosophy that says, well, markets cannot work in healthcare. Healthcare is different. But that's not true.
It's not.
And so, yeah, you're right. The pharmaceutical is a big piece of it, too.
Well, and from the pharmaceutical companies, I think, if I was their public relations department, I'd be wanting to get rid of these middlemen, too. I mean, these are the door-to-door, fuller brush salesmen. And these are the folks who, as we watch more and more of this stuff get unearthed about opioids, they're the ones who are whining and dining physicians to just, push the product. Oh, we've got an ad campaign coming out for... I'd want these guys outed and get out of my industry because you're killing my reputation.
Yeah, absolutely. There's a lot of corruption in healthcare because of the special privileges and monopolies that government has created. If consumers were in charge, you wouldn't see so much corruption because, it's like in any other industry, it works itself out. I mean, here's the model of American healthcare as I see it. It's like a grocery store, except when you get to the parking lot, someone stops you and says, now, wait a minute, is this grocery store in your network? Oh, it is? Okay, you can go in. But by the way, aisle 15... that's not in your plan. You can't do that one. And those are higher tier. You got to pay more for those on aisle 13.
Oh, yeah, that's a great example.
You have to have prior authorization on aisle 16 and 17. You don't even get that unless we say it's okay. And so on. And by the way, there's no prices on any of the shelves.
Right.
That's healthcare in America today. We put the consumer in charge in the way that you and I have just talked about with health, tax-free health savings, direct primary care, basic insurance coverage. And now you'll get price transparency. Now you'll get prices coming down. It'll be great. And we can do it. We do have to fight those special interests.
So where can people find out more about the fight and how to join in?
The best place to get more information about our personal option approach to health reform, including health savings accounts, is a website we've set up called personaloption.com. Personaloption.com.
I love it. And just go there. And thank you so much, Dean, for everything you do. It is so commonsensical. I just don't know why we continue with the abuses. While Jefferson warned us, people will tend to deal with the abuses as long as the abuses are manageable. As long as we haven't canceled him completely yet, that's still there in the Declaration of Independence. So he understood what we're going through. But we need to not be afraid of the change. I was just checking. There are some direct primary care physicians in our flagship city area of Charlottesville, but I'm not finding any in the Lynchburg or Roanoke areas where the show is heard. If you are one, let us know, and we'll certainly let folks know about it. But thanks for everything you do, Dean, and thank you for joining us this week on Freedom and Prosperity Radio.
It was my pleasure.
And coming up next, we're going to go to the Capital Research Center. Bruce Yandel, he's Senior Vice President, and he just wrote a great policy brief, The Economic Situation. It's a page-turner. Next on Freedom and Prosperity Radio.